welcome back to BNN TV. My name is Abby Nguyen-Burke, and today we have a special guest, Stan Jung, who is a candidate for the 1st Congressional District of Rhode Island. Welcome, Stan.
Thank you. Thank you for having me.
Yeah, thank you for coming. So tell us a little bit about yourself.
So I guess I should start with my parents. I'm Vietnamese. My parents are from Vietnam. They left the country after the war, so in the early 80s, and they were boat people. And in fact, my dad didn't even have enough money for the boat passage, so he was a stowaway. And he just like pretended to be a crew member, walked onto the boat, and by the time they found out, like they couldn't kick him off because then, you know, the authorities might catch on. So my father didn't even have enough money for the passage out of the country.
Wow.
But now that, you know, they have a house in California, and they have 2 cars, and so they're very proud to be Americans because they've done a good job.
That's
in
fantastic.
This country.
Well, and so they're from Vietnam. What part?
Southern Vietnam,
Okay.
both of them.
Okay.
Like the Saigon area.
Okay. And then you said they have a house in California. So what got you here to the Northeast?
So I went to Stanford University. After that, I taught high school in Arizona. And then I came to Brown for medical school.
Okay.
So I finished my 3rd year of medical school, and I've been in Providence, Rhode Island, which is about an hour away from here.
Okay.
And I've been there for 3 years.
So studying to become a doctor.
That's right, medical, yes.
Okay. And then, but you still want to go into politics. So tell me.
So I didn't have any inclination of wanting to go into politics until I started medical school. And I realized that people get sick because they're poor. That's not the only reason, but that's one of the reasons. Like patients can't afford their medications. They cut their pills in half. And to fix that, that's beyond medicine, right? That's like the political world, the social aspect of it. And I've tried to address that issue within the field of medicine, but there just wasn't an audience. So I'm taking my message to the people. I'm taking a leave of absence from Brown to run for Congress.
Okay. And so it's the 1st Congressional District of
Yes.
Rhode Island. Tell me where that territory is.
So Rhode Island's a small state. There's about 1.1 million people. There's 2 congressional districts. The 1st congressional district is sort of the eastern half. So that's Woonsocket, covers the towns of Woonsocket, Pawtucket, half of Providence, Barrington, and then all the way down to like Newport.
Oh, okay. And so our audience is predominantly in the Boston metro area. So
Right.
tell them a little bit how they can maybe help you or try to get the word out.
So the issues I'm talking about, like Congress is a federal office. So the kind of issues I'm working on, trying to get the cost of healthcare down, improving the economy, like through vocational training. These issues apply to all communities, I think, across the country. I mean, as a country, we pay the most for healthcare, and it's not isolated to Providence or Rhode Island. It's the United States. So these issues are relevant, and I think if people want to help, they can, you know, learn more about my ideas by visiting my website. It's www.stantran.us, and tell other people about it and about the work and ideas I have.
Okay. So obviously healthcare has been a hot topic in the past,
For a
2
while,
years or so with President Obama and the Affordable Care Act.
Right.
So with the Affordable Care Act, do you think that has made a difference for Rhode Island, or is there still more things that you want to?
There's been a lot of changes with the Affordable Care Act. The insurance policy has changed. We have the state health insurance exchanges now. But the main problem that we've had for like the last 20 years is a rising cost of health care. And the Affordable Care Act hasn't fundamentally changed that. I mean, it's not affordable. The costs are still going up. We haven't brought it down yet. And as a country, we spend the most of any developed country on health care, and we get the worst outcomes.
Yeah.
So we can definitely get better for less money if we
Yeah.
just rethink some of the basic assumptions of how we do provide health care.
Okay. And then, so I'm guessing, so you've been in Rhode Island for the past 3 years?
That's right.
Okay. What other initiatives, things have you done in Rhode Island to get to know the community, to affect the community?
So I was a volunteer with the Court-Appointed Special Advocates. It's if you're like a foster child, you're going through the court system, the court assigns you a lawyer, and I was a volunteer with that program. And so my job was to make a recommendation to the judge on where the child should be placed.
Okay.
And that's like a really cool responsibility to have. I mean, I was starting medical school, and like in medical school, you don't have, I mean, you learn a lot, but they try to not give you too much to do because they don't trust you yet. And here I was out and like, deciding where this child should be placed. If they should be placed at home with like with the stepfather and the group home, like these are big decisions, and that was really cool to be able to see the home life of these children. And also in my work as a medical student, I meet a lot of people and I learn about their home life, social life. And I also volunteer with the homeless community in Rhode Island, so I know about their issues too.
Okay. Homeless community. Well, with Rhode Island being kind of the highest unemployment rate,
Right.
tell me the I guess for status, I can imagine for the homeless community that has to be high as well.
Yeah, so Rhode Island has the highest unemployment rate of any state in the country, 8.3%. And that doesn't include like people who are underemployed, right? People who like work 1 day a week. They're technically employed, but they're working below their potential.
Yeah.
Or people who are employed in a job that's not appropriate for them because they can't find the job that's appropriate for them. So if you include all those numbers, you're looking at 20-25% of the population who are underemployed. And that's a huge chunk, like 1 out of every 4 people.
Yeah.
So I think the government in Rhode Island hasn't been very responsible and hasn't done a good job for the state.
So along with your healthcare, how or what initiatives do you think you could help with unemployment?
So I think people see like healthcare and the economy and education and all these issues as distinct, separate issues, and they're not. They're all very tied together. I have ideas on how to fix the unemployment issue, and I'll get there. But I just want to connect the dots between the healthcare and the economy. America is the only country where the employers pay for healthcare. And so as the cost of healthcare goes up, you don't see that, your employers see it, and that increases the cost of business, which this is why American businesses are less competitive. When you buy a GM car, you spend more money to pay for the workers' healthcare than money for the steel in that car. This is why companies are moving out of this country. In Rhode Island, like the unions are thinking about going on strike because of debates over who would pay for the rising costs of healthcare premiums. Right, so getting the cost of healthcare down is going to help the economy. It's going to help decrease the cost of labor and keep jobs here in the United States. I think we focus too much on trying to get kids to go to college in the last like 10 or 20 years. Like the push has been, if you want to be successful, you have to go to college.
Yeah, you gotta have that degree.
Right, and now we have a lot of students who has a college degree who can't find employment. And even worse are students who drop out from college, who have debt and who can't find employment. And many students drop out of college, and that's not a statistic that you hear about, right? Because you hear about, this is a high school and we send 90% of our students to college. Well, that's great, but how many of them actually graduate? And so we're not looking at the full picture. We're just looking at bits, like little pieces, and trying to get that number up. And I think in that we have lost sight of the bigger picture. I think we've lost respect for blue-collar workers. America still needs skilled labor. A job like a carpenter or plumber or electrician or web designer or filmmaker, these are skilled jobs, and that it takes years of learning with someone skilled in an apprenticeship, and we've lost like the infrastructure for that. So I think we should bring that back and have that be an option for high school students who are interested in other fields.
Okay. So you definitely have a wealth of information about, healthcare as well as some of the education statistics. But for politics, was there somebody that you had looked up to that maybe gave you the idea? What was your motivation?
My motivation was watching TV and watching politicians on TV and thought, wow, they're not really saying anything. They speak in broad terms like building a better road to the future. And like, what does that mean? Yeah. So I thought, well, I can have specifics. And now, having done this for like the last 6 months or so, I realize that politicians are very smart people, and that it's not because they lack ideas, it's because they don't want to disclose them. Because if you do, then you get pinned down by your opponent. And I think that's a terrible way of approaching politics. I've been told that I should fundraise money so I can run polls, so that I know what people want to hear and feed that to them. But that's not fixing anything if you just tell people what they want to hear. So I came up with my platform before I started all of this, and these are my ideas. These are pretty sort of original ideas. They're not like Democratic ideas or Republican ideas. These are different. And I think these ideas can solve things, so they make sense. These are based in evidence, based in fact, and not based in ideology. And so it's not looking up to somebody. It's just being upset at what I see and thinking that perhaps I can do better. Yeah.
Okay. So, as you're a West Coast transplant per se,
yes.
Younger. So tell me, as the audience and as some of the voters, what makes you how can they trust that you're going to stay, that you're, and also that you are well experienced enough and
Right.
make a difference, and that what's the difference between you and other candidates?
So I'm 26 years old, and I've only been around for 26 years, and you've had more life experience than I have, and so you're wiser than me in many ways. And I don't think I have all the. I mean, I can't come up with all the solutions myself. But I've learned that you should be a good listener, and the correct answer is always around you. People have them. You just have to ask the right people and listen to people. And listening is a skill that I've worked on as a medical student, listening to your patient, to their problems. And on the campaign trail, I've learned that the key to being a good politician, I think, is being a good listener. The key to being a good teacher, I was a high school teacher, was to be a good listener. It's to not like force feed information to your students, but you have to understand where they are at and where they're coming from.
Okay.
And so I think that's a different take on politics. Like
Okay.
I'm out there, I'm listening to people, listening to what their problems are and where they're coming from, and trying to have my message be at a level that can connect with them. And I listen to other people in the communities who come up with ideas.
Yeah.
So I think that the approach is different, and I think the approach is a successful one. In terms of trying to accomplish things, my ideas are different, and right now Congress is more polarized than ever. And so if you come in with a Republican idea or with a Democratic idea, it's not going to get passed because the other side won't go for it. So these ideas are original, and I think that both parties can get behind a new original idea that solves, everybody wants to get the cost of healthcare down, right? That's a universal. But how do we do that in a way that doesn't upset anyone?
Yeah.
And I think I can do that, so.
Done. And so how is your campaign going? What efforts have you done? And, the school or the student associations, have you had any support from that?
So you mean from the medical school?
Yep.
I think my classmates support me. Some of them think I'm crazy for leaving. I mean, some people think I'm leaving medicine as a career, and that's not true at all. I think medicine as a career and politics isn't. I think being a doctor is better. It's more rewarding. It's more fun. I mean, in the 6 months or so I've been on the campaign trail, I've learned that people get involved in politics because, for the most part, they're people who want power. And some of them aren't very pleasant to be around. Whereas if you're a doctor, you work with your patient, it's a very pure relationship. And so I have no intentions of making politics my career. I just see an issue that I can't address in medicine, and I want to improve the healthcare system so that when I do practice medicine, it'll be a place that I can do better good in.
Okay. So have you kind of gone out and started knocking on doors and gone out in the street? So what are some of the concerns that the people, the voters, have been asking you, the questions?
So whenever people gather, I'll be there and I show up. And so I go out and try to meet as many people as I can. Anytime there are community events, I try to show up and shake some hands and meet them and introduce myself to them. I think the biggest challenge is name recognition, right? People can't vote for someone they don't know. And generally the way you do that is to run TV ads. And it's crazy the amount of money that goes into politics.
I can imagine.
To run a competitive campaign, they expected to raise anywhere between $500,000 to a couple $1 million. I mean, the last election cycle in my district, which isn't a competitive district, one person raised $2.5 million, another person raised $2 million. And you're fighting, if you work out the amount of money per vote, it's something like $60 or $80 per voter, and it's just crazy amounts of money. And that money is going towards TV ads that doesn't accomplish anything.
Yeah, it's not making.
If you took that money and put it into a school, you can build a whole new school every 2 years for that, and that's crazy. But the money buys you name recognition. That's how you're supposed to play the game. I'm doing it by just going out and trying to put more hours in and meet as many people as I can.
Have you met with any of the existing congressmen or state reps and mayors? Or any particular advice that they've given you?
So Rhode Island is a very, like most states in the Northeast, is very one. The Democratic Party kind of controls the whole thing. Of the 75 state legislators, 69 are Democrats and 6 are Republican. So it's very one-sided. And it's a machine that kind of controls everything. If you win the primary, then you win the election. I'm running as a Republican. And so the people in power right now, as soon as they find that out, they don't talk to me because I threaten their power structure. And so not very friendly advice from the people who are in office right now.
Gotcha. So also, but I guess for your ethnicity and running as a minority. Tell me, unfortunately, I'm sorry, I don't know as much of the politics in Rhode Island, but are there other minority leaders in Rhode Island that you can maybe ask or help or whatnot?
So there are, but I think for a lot of people, the party affiliation drives everything else, and that overrides everything. So I've had people who like me and who support me and who want me to win, but they can't say that publicly because it threatens the power structure, right? I mean, my opponent is an incumbent. He's been in office for 4 years, in Congress for 4 years, running for his third term. Before that, he was mayor for 8 years, and he's from the state. His family is in the state. And so his influence runs deep.
Yep.
So people who don't like him can't support me because there's retribution if you support the wrong candidate. So politics is dirty, and I've learned that. But I think those people don't control the election. I mean, the election is a vote, and most people, the majority of the people who vote are good-natured people, and I trust them to make the right decision.
Good. So let's talk a little bit about, we did talk about California. So you went to Stanford. What were you studying in Stanford?
So I majored in biology and I minored in physics.
Okay. And so life in California, what part of California?
Northern California, Santa Clara. It's right outside of San Jose.
Okay. So tell me a little bit, just so that people can, get to know you and familiarize themselves with you. Tell me, kind of hobbies and friends and family, things like that.
So I have a younger brother. I have one brother. He's 19 years old. He's studying engineering at Cal Poly.
Okay.
My mom's a nurse.
Awesome.
And my dad is an electronic technician, so he repairs like electronic equipment.
Okay. Good.
What was your other question?
Hobbies.
Oh, I enjoy the outdoors a lot. I bike a lot, swim, triathlons, stuff like that. Try to be active.
So Rhode Island's a good place for the outdoors with the beach and.
Yeah, and as long as you can put up with the winter, which it's fine. I actually I didn't have a car until recently, so the last 2.5 years I biked everywhere, including through the winter. And
wow, impressive.
I think it's a lot faster to bike through the winter than it is to drive because you don't have to shovel your driveway or shovel your car. Like you just get there. It's much faster.
There's a lot of hills in Providence.
A little bit, yeah. There's College Hill,
Yeah. So we have about 5 minutes left. I'm going to give you a little bit of time, maybe that you want to speak in Vietnamese to the audience. Kind of a little bit about your pitch, your campaign.
Okay. So Stan là người Việt. Ba má đẻ bên tiểu bang California. Ba má là từ nước Việt Nam. Học ở Đại học Stanford. Học xong dạy học ở trung học trong 1 năm. Xong rồi ra trường y khoa ở Brown Medical School. Học xong năm thứ 3. Bây giờ xin nghỉ để tranh cử vào Quốc hội Hoa Kỳ. Stan làm cái này tại vì Stan thấy là bệnh nhân của Stan bị bệnh tại vì không có đủ tiền mua thuốc, mà muốn giải thuyết cái điều đó là lớn hơn ở trong nghề y khoa, phải vô politics. So Stan xin nghỉ để tranh cử vào Quốc hội Hoa Kỳ. Nếu mà muốn biết thêm thì xin visit my website, www.stantran.us.
Và Stan muốn nói quý vị ở nhà làm sao để phụ Stan?
Oh, so nếu mà quý vị muốn biết thêm mà nói cho nhiều người biết, spread the ideas.
Okay, all right, perfect. So when is the date to go out to the ballots
So
for you?
the primary is September 9th, and then the general election is November 4th.
Okay, so everybody, please tell your friends, family from Rhode Island to go out on September
9th for the
September
primary.
9th for the primary. Thank you so much for taking time out to come and talk to us.
Thank you
we
for
really
having me
appreciate you. Thank you everybody for enjoying tonight's program, and we will see you guys next week. Have a good evening. Thank you.